Hey, this is Sonal, and you are tuned into the Reboot podcast. It's some of the best bits of our show. I hope you enjoy it. It is 4 minutes past 11 on your Sunday. We'd love to hear from you, hear how it's going this weekend. I'm Sonal. Zina is alongside me in studio. And Zina, I got a chance before Dan shut off to ask him about his ChatGPT usage when it comes to illnesses. I'm going to put you on the spot right away. Is this something that you do? Do you end up looking up things that you think are wrong with you? It's a bit addictive once you get into it, you know?
It could be, yes. I have never done that, but I used to Google symptoms a lot, but I stopped because it was making me paranoid, because every single symptom that I entered into Google
ends with cancer.
Cancer.
Yeah.
You might have cancer.
Yeah,
you know?
That's the thing. Everybody knows that. The moment you Google your symptoms, some way or another, it leads you to cancer, right?
Yeah. How could I have cancer every single day? You know, leukemia on this day and then the next day it's a different kind. But I do use ChatGPT as a therapist, because therapy is so expensive, right? So if I can just say, act as my therapist. What is wrong with me on this day? Why do I feel this way? I'm not sure if that's something that's recommended.
How has that worked for you? I'm curious, because I have a friend who does this, who's quite concerned about certain things from a mental health perspective, and he uses ChatGPT to kind of act as a sounding board for things that he thinks. But when you ask ChatGPT to be your therapist, do you find, is it helpful? Is it actually able to give you something useful, or is it just being sycophantic, as we mentioned, and just being like, you're great, don't worry so much? You know?
It's overly sympathetic, but also it gives me actionable solutions.
It does.
So if it reframes a problem for me or a situation, and then I think I look at it from a different perspective, and it literally changes my mood.
And one of the reasons we're talking about this is because we've seen a number of stories circulating online. We're going to start with a name you might recognize. Reid Hoffman is a co-founder of LinkedIn, and he actually shared on his LinkedIn profile a Reddit story that really kind of hit close to home for a lot of people. It's about an individual who described having jaw clicking on the left side, 5 years of this, claims probably from a boxing injury. Every time I opened my mouth wide, it would pop or shift. Sometimes I could stop it by pressing my fingers on the side of a jaw. I figured it was permanent damage. After 5 years, this person says, yesterday I randomly asked ChatGPT about it. It gave me a detailed explanation saying the disc in my jaw was probably just slightly displaced but still movable, suggested a specific way to open my mouth slowly while keeping my tongue on the roof and watching for symmetry. I followed the instructions and just no click, just like that. 5 years of having this jaw click, and with one query to ChatGPT managed to resolve it. Now, this is a relatively harmless situation because it's a painless jaw click we're talking about. There's clearly not that much at stake, but there's still so many stories where we do see things at stake. There was a Reddit user who described doing a workout, super sore the next day, hydrated, felt really off, but couldn't put it together, asked ChatGPT what might be going on, and actually got to something quite rare. I'm going to butcher this one. Rhabdomyolysis.
Yeah.
There we go. A very rare condition that was about sort of his muscles and how it was reacting. Goes to the hospital. Turns out ChatGPT was right, and it may have saved his life. Now, these are all stories of people on the internet, right? So you do take it with a pinch of salt. But another one I saw just this past week that was well reported in the UK is a woman who couldn't get her doctors to take her seriously. She had certain symptoms and claims that she kept going back to doctors. They diagnosed her with arthritis and acid reflux, but she wasn't satisfied. She didn't feel right to her. So she goes into ChatGPT, enters her symptoms, and she finds out that she may have Hashimoto's disease, which is a thyroid-related issue. Pushes her doctors for tests. They're like, no, you don't have this. They do the test. It turns out she does. Not just that. That prompted some scanning, and it turned out she actually had some cancerous lumps in her neck that she had removed. So she says if she'd waited, she doesn't know how long she'd be around. So it raises a really interesting question. So we wanted to get some experts in to discuss this. And of course, ChatGPT isn't a doctor, but I think a lot of people are going to it to ask certain questions. So we have two guests in the studio with us today. We have Dr. Yasser Shafi, who's a homeopathy practitioner at Wealth. Dr. Yasser, thanks for coming in today.
Thank you so much for having me here.
And we also have Dr. Ed Cody, who is a family medical consultant at Mediclinic Parkview Hospital. Good to have you here, Dr. Ed.
Hi, thank you so much for having me here this morning.
Now, I need to ask you both a question. I'll start with you, Dr. Ed. Are you seeing this in your practice in the first place? Is this something that's on your radar where people are coming to you and saying, listen, I've been talking to ChatGPT and this is what it's telling me. I want to look into it. How prevalent is this?
This is so prevalent. Whenever I think about it, even just in the last week, I have had maybe 5 or 6 patients come in with a printout from ChatGPT as discussion points for their consultation. Me personally, as a doctor, I absolutely love it whenever patients come in with this, because it means that they're interested, they've done a bit of research, and then we can have an informed discussion regarding the information that they've gathered. Let's have a talk about the points raised from ChatGPT and have it make a decision whether these are logical outcomes or whether we need to do some more tests to prove or disprove what ChatGPT has raised.
And I'm sure a lot of people are exactly that, using it quite rationally and logically and just kind of using it as some ideas of where we could go from here. But does it ever get annoying? Are there people who get really fixated on certain ideas because of this, because ChatGPT told them it could be so?
Yeah, there's been a couple of irritations in the last week. I've had 2 patients come in to me with a massive list of tests that they wanted me to order. I looked on this list and I said, what on earth are these tests? I don't even understand how to interpret the results of these tests. Where did you get these tests from? ChatGPT raised it. And I think with everything, it has its flaws as well too. So, these patients that came in with tired all the time symptoms, something we all experience all the time, and it had suggested maybe 20 tests to be done, of which maybe 3 or 4 are the basics that we should definitely be starting with in this scenario. But what ChatGPT maybe wasn't able to interpret was just the relevance and the logical order that these tests should be done in as well.
I think just a quick follow-up to that, when you say, there's the 3 or 4 we should be doing, but there's potentially so many others. A lot of people feel that if those 3 or 4 are now answering their questions, they want it to be exhaustive as possible because they want to find the solution.
Well, definitely, yeah. But then we go about things in a logical order. We do the 3 or 4 most obvious ones. I suppose common things are common, and then if we haven't got to the answer after that, then we broaden the scope of the search to try to encompass all diagnoses that it could be, and we go into detail at that stage.
Right.
So.
Dr. Yasser, what's your experience with this? I mean, in your own practice, have you seen people coming to you again with these similar concerns, and what's your reaction to it?
Absolutely. Everybody goes through ChatGPT these days. So whenever they come with something like this, I just make them aware on few things, that it's good to be aware of your health, symptoms and everything via ChatGPT, but you should not reach the conclusion, which is like the prescription or diagnosis. Because it is like an AI response based on your words you have input, right? So say, for example, somebody asks ChatGPT related to their fatigue symptoms. And maybe sometimes there is an underlying condition which they might not reach, because many a times we see a condition, any health concern going on with few symptoms rather than the obvious ones, So for that, we need to go... we need to do a lot of blood tests, investigations, or a generalized complete physical examination by a doctor is something which I think most of the time ChatGPT won't be able to do it, right? So that's an important aspect.
How do you feel about some of the stories that we raised at the start of the show? I mentioned a number of them. Again, as I've said, they're online stories for the most part. People have been sharing them with news media or with forums on Reddit. But when you hear these stories of people saying, I've been trying and trying and trying to get an answer to this, and it is almost like a last resort, how do you react to some of those stories?
So see, there can be some exceptional cases where maybe many of the doctors might miss something. And since ChatGPT have you can say a vast knowledge base, on that basis, they might get some peculiar answer which doctors might have missed. But still, the final conclusion is still go to the practitioner and go to the doctor to make sure what to do next.
Now, I've been asking people, and a few of them said, Josie said, I use it regularly for health-related questions and test results. It's wonderful. Better explanation than doctors, to be honest. And Angie says, ChatGPT is so helpful. Explained my labs to me the other day so much better than the nurse did when she called. Do you ever think, oh, this is really messing up my practice if people start believing that ChatGPT is better than me? And how are you dealing with that? Dr. Yasser.
So see, as I said, explanations, understanding symptoms and health concerns, it's a good platform, to get data from. But again, the last thing, which is like prescribing something over that explanation, should be via doctor or therapist only.
Do you get annoyed?
For sure. Sometimes. Sometimes. But see, just like doctor said, most of the cases, it's good to know that the people are interested to know about their health, to understand it well, rather than being fixed on something, right? So in that way, it's good.
Dr. Ed, you said it's definitely helpful, but there is some irritation in the past week. So which one is it? Are you more annoyed or more, okay, this is informing my patients better?
I'm definitely about it informing the patients. It creates a really good basis for the discussion, but it does have its flaws as well too. You get out a list of blood results. I often believe in treating the patient rather than the numbers as well too, and this is something where I think ChatGPT might have its limitations with.
Well, Dr. Ed, to put what Zina was just bringing up a moment ago, something she's heard directly from people who live here in the UAE, a specific area is people feel their doctors and nurses are not explaining lab results well enough, that they need to go to this resource because their health practitioners are not doing the job for them. I mean, how do you feel in reaction to that when you hear this from patients?
I feel a little bit disappointed actually in the trust on the medical field there, and I think that's a breakdown in communication between the patient and the practitioner in those scenarios. I tend to feel that I maybe talk more than a lot of doctors about the results and explain that you might get 20 values back, of which 3 are of any relevance, and but taking the time to explain the ones which are maybe just outside of normal values but are actually fine in the long term.
We are talking about something I'm pretty sure everyone out there has done by now, and that's looking up your symptoms, whatever they are, medical symptoms, physical, mental health symptoms on ChatGPT and trying to make sense of things. We have 2 doctors in studio with us. Dr. Yasser Shafi is a homeopathy practitioner at Wealth, and we also have Dr. Ed Cody, a family medical consultant at Mediclinic Parkview Hospital, in studio with us. And we've been talking about how many people are now showing up to the doctor's office with their research done, with their printouts of ChatGPT. I think we've all been there, and how doctors actually feel about it. Zina, you've been talking to some people around town, around the UAE, to get a sense of how much this is an issue for people and how they're using these tools as well.
Yes, because when we were talking about this story, I thought, okay, how common is this? So I asked around, and dozens of people came forward and said, admitted to using ChatGPT. But there's one particular resident, Nasreen. She uses an app called ADA, ADA, to check her symptoms. This was developed in the U.S., I believe. She's also a tech enthusiast, by the way, and a listener of the Reboot. And she says it's a good substitute for a doctor. Sorry, doctors.
It especially came in very handy during COVID when everybody was very scared to visit the hospital. At that time, it kind of helped us keep track of our symptoms, helped us understand the symptoms and criticality and urgency of visiting a doctor as well. So it basically mimics your visit to a doctor.
So she's talking specifically about this app called ADA, which uses AI to offer specific medical advice. And it's trained in a different way than, let's say, ChatGPT would.
Exactly. And we actually reached out to the developers of the makers of ADA. They're over in New York and London. And basically, Dr. Adel Baluch, he's the VP of Medical Affairs. He said, okay, this is not just ChatGPT. It's actually certified by, it's compliant with all the regulatory boards in medicine over in Europe and over in the States. So this is a little bit more than ChatGPT in that it's developed specifically by scientists and doctors.
And it's not just Nasreen that we heard from. Pete said, I always put my test results asking for a diagnosis. Tim has said you can put X-ray and MRI scans into it and ask it to explain what it sees. It worked great when I injured my back. I think, doctors, what we're seeing here is not just people doing the research before they come to you, but some people using it as a replacement altogether. And, we can give our advice or warnings against that. But Dr. Yasser, how do you react when you think people think that this machine, this AI, can do as good a job as what I've spent all my life training to do? How does that make you feel?
So I think in future it will be a great thing, to add on in healthcare sector. But still, I believe there should be that human touch to any kind of these AI tools and anything coming in the market, because there is higher chance of any, you can say, errors in all these things. Like patient can get deviated to anything else. Say, for example, patients get an accurate diagnosis related to their symptoms, but maybe there is something more important going on in the body, which they might, AI might just avoid or can't get it. So it's a very important factor, important aspect to go through a generalized physical medical examination through any healthcare professional.
Dr. Ed, I think a lot of what's underlying, we can say, yes, of course, it's important to also go to a doctor, but I think underlying this whole discussion, not just with AI now, but just in general, people getting their health information from Instagram instead of a doctor, it goes more broadly than just ChatGPT, is a feeling from some patients that doctors just aren't listening and can't help you with your issues, so you need to resort to some other solution. So just as an example, I think you hear a lot about people with gut issues for years just being fobbed off with IBS, nothing you can do. Mm-hmm. And then people educated themselves. And now we have influencers talking about the gut microbiome. And you've got more information that's being pulled out there from people who felt fed up that there was no solution for them. I think there is a sense of desperation that's also behind this. Do you think that there is a sense out there, do you hear this from patients, that people feel they're not getting what they need from their doctors?
Yeah, at times. I do get that some patients who come in with slightly vague symptoms, but perhaps the patients haven't read the medical textbooks before coming to me with the classic symptoms, that they get a bit frustrated with the medical care that they've received over time. Sometimes they feel they're just being over-investigated and not actually listened to as well too. And this is all comes down to the doctor-patient relationship, and really, if you feel your doctor's not really listening to you, I think you should probably tell the doctor that is the case, or potentially move to a different doctor, because you really do have to connect with your physician.
My mom, when she was alive, she had one nephrologist, and I kept telling her, you should seek a second opinion, maybe a third opinion, because this is too important. This is your life on the line. And she wouldn't. She absolutely loved her doctor. And then I've got, different relatives who would just consult 5 doctors for one illness. Mm-hmm. So it's really different. When you find that doctor that you like and you feel like listens to you, then you stick to that doctor. But I want to know, doctors are now being forced to learn about AI because obviously, number one, it's competition. Number two, it can supplement with how they treat people and how they deal with patients. So I want to know if you're thinking about, upskilling, learning AI, working alongside AI, Dr. Yasser.
So for sure. So we have to evolve with time. We can't say whatever we know is the ultimate thing. So we should always evolve with all the technologies and anything going on. So AI is advancing in everything. So doctors should be equipped with it. But just like you said, it should be a supplement, not a solution. Dr.
Ed?
We have this massively powerful tool at our disposal. Why wouldn't we use it? I do use it. I use it for dictating patient notes. I use it for some cardiovascular risk profiles. But again, it always needs human input. It really depends on the quality of the information, the prompts that you put in to what the output is. And the output always needs to be proofread by a human, I believe.
In the medical field, what can AI currently do better than a human? And we've heard a lot about radiology, for example. Are there other areas that you've seen this or that you've heard of, different doctor friends discussing surprising results, for example?
Yeah, radiology, microbiology as well too, where it looks at different bacteria and predicts what antibiotics might be best used for certain infections. I think it really has its use there. Radiology, I believe, always should be looked at by a human set of eyes as well as the AI tool. For example, I had a patient come in during the week, and we have an AI tool and which looks at our x-rays. Her husband sat on her leg by accident, and she came in hobbling and 3 days later she said, I wonder if my leg is broken. We did an x-ray, and the AI tool said that there was a fracture on her leg, and I was like, I cannot see the fracture here, but I felt maybe I'm missing something, so I sent her off to see an orthopedic surgeon, who then said, Ed, what on earth are you doing sending this patient to me? There is no break in this bone. So again, it just is a tool, but it needs a further set of eyes.
Yeah, I think we all know it hallucinates sometimes, doesn't it?
It does. In fact, I was writing a script earlier, and you totally called me out. You fact-checked it, and it turned out to be completely false, the first few lines.
Well, I think that's the thing. I think regardless of what field you're in, whether you're in the medical field, whether you're working in radio, you do have to fact-check what it's giving you.
Totally. And I'd just like to add to that, if a patient ChatGPTs everything and basically treats ChatGPT as their doctor, and actually not going to a doctor, just, taking whatever ChatGPT says, but if they get into trouble or if they get really ill, if their illness worsens, then who are they to blame? At least if the doctor says something and you do it and you get even more ill, then you have the doctor to blame.
Yeah, you don't want yourself to blame for that, do you?
That's true.
Thank you so much for coming in, having a chat with us, Dr. Ed. Thanks for coming in today.
Thank you for having me.
And Dr. Yasser as well. Thanks for coming in, having a chat. Because, of course, it is, the common advice or the practical advice that you would say, definitely, yeah, sure, you can look into your symptoms, but make sure you're speaking to a qualified doctor as well. I think that's fair to say. That's the end of sort of the overall takeaway from that conversation. Thanks again for having a chat with us. And you can get your messages in, of course, to us on the Reboot at any time on 4001. We're going to be talking about something a little bit interesting next, Zena. There's something, a big name that's coming here to the region. And I think you and all the Gen Zers out there are going to be really excited. Stay tuned.
You're listening to the UAE's #1 talk radio station.
This is The Reboot
on Dubai Eye 103.8.